Hello, this is Bindu. In this video, let's see COPD symptoms, diagnosis and treatment. COPD, chronic obstructive pulmonary disease. This is primarily an umbrella term for two conditions, emphysema and chronic bronchitis. Someone with COPD may have one or both of these issues, and the severity of each varies from person to person. COPD can limit your ability to work or even do simple daily tasks. There are chronic inflammatory diseases characterized by airflow obstruction. People suffering from COPD are at a higher risk to be diagnosed with other heart problems, lung cancer and various other conditions. Emphysema damages the air sacs of the lungs. Due to this, lungs lose their elasticity and are no longer able to exchange oxygen and carbon dioxide efficiently. What causes COPD? Though cigarette smoking is one of the major reasons for a person to be diagnosed with COPD, there are other factors as well that contribute to the development of COPD. Most people with COPD are at least at this age of 40 or above, and they mostly have a history of smoking. Genetic susceptibility and other irritants are also risk factors for COPD. Here is the list of risk factors for COPD. Exposure to tobacco smoke. Cigarette smokers, cigar smokers, marijuana smokers, or even pipe smokers are at a higher risk of developing COPD. People who are exposed to second-hand smoke too often can also develop COPD. People with asthma. Asthma is a chronic lung disease and it can be a risk factor for a person to develop COPD. Genetics. Alpha-1 antitrypsin deficiency is a rare condition of genetic disorder and it can cause COPD. Workplace exposure to chemicals and dust. Long-term exposure to irritants such as vapor, fumes, chemicals, dust can inflame the lungs and may contribute to the development of COPD. Household air pollution. Prolonged exposure to household smoke emitted from the fuel burning such as wood, agricultural waste and animal dung contribute in the development of COPD. Now, let's get into the symptoms of COPD. COPD makes it difficult for a person to breathe. Initially, symptoms can be mild, but as the diseases progress, these symptoms can become severe and frequent or continuous. Often it is not diagnosed until the condition reaches an advanced stage, as people might not know how to recognize the early signs and symptoms of COPD. The primary symptoms of COPD are producing an excess amount of mucus, chest tightening, coughing, wheezing, shortness of breath after exercising or even after climbing a few stairs, frequent respiratory infections such as cold and flu. In later stages of COPD, a person may experience fatigue, weight loss, blue or gray fingernails, inability to talk, feeling confused, etc. And these symptoms would require immediate medical attention. Let's see the types of COPD diseases. Emphysema and chronic bronchitis are the two main diseases that contribute to COPD. These conditions might also occur at the same time, but the symptoms and severity of these conditions vary from person to person. Refractory asthma is also part of COPD disease. Chronic bronchitis is caused due to the inflammation of the airway linings of the lungs. These airways carry air to and from the air sacs of the lungs. One of the significant signs of chronic bronchitis is a daily cough and mucus production. The symptoms include breathing problems, frequent infections, and disability. Emphysema is a condition where damage is caused to the fragile walls and elastic fibers of the alveoli. When a person exhales, small airways collapse out of the lungs. The damage to sacs is irreversible and it results in permanent hold in the lungs tissue. Let's see the diagnosis and treatment of COPD. Along with the questions asked by the doctor about symptoms and family history, there can be few tests recommended for confirming the diagnosis of COPD. One of the most reliable ways to diagnose COPD is Spirometric Test that measures the speed and amount of air a person can blow out of the lungs. Another test called oximetry can help to estimate how much oxygen is present in person's blood. Other tests that can help to diagnose COPD are blood tests, peak flow test, ECG, chest X-ray, CT scan, etc. The first step towards managing COPD would be to stop smoking. At times, if breathing is affected, the person might be asked to use an inhaler. Pulmonary Rehabilitation is an exercise program designed for people suffering from lung diseases such as COPD. Other treatment for COPD includes long-term oxygen therapy, nebulized medicine, or even surgery for patients with severe COPD. Let's see the complications in health. Many other health problems accompany COPD. People suffering from COPD are at higher risk of being diagnosed with any of these conditions: respiratory infections, lung cancer, high blood pressure in lung arteries, heart problems, depression. COPD requires long-term disease management and it significantly impacts on a person's lifestyle. Having an action plan for emergencies will help to be prepared. COPD reduces life expectancy, but with treatment and management of symptoms can make life comfortable. Live with this chronic disease. Hope you really like this video. If you have any queries, just please mention in a comment section. See you all in the next video.